welcome again to this session, especially the epidemiology of NCD. So basically we are waiting for our today's special guest and also for the today's presenter. We know the importance of epidemiology regarding NCD. About 68% of deaths in Bangladesh are due to NCD and chronic health disease. So we can understand the importance of this session, and we hope we will get some insight from this session, from the presenters, and also from distinguished guests. So now I would like to request for today's session chair, Dr. Jeba Mahmood, Senior Advisor, Strategic Partnership and Knowledge Learning, Alive and Thrive. I also would like to request today's session chair, Dr. Abu Jamil Faisal, Chairman and Treasurer, Health 21. At the same time, today we have three speakers. First, I would like to ask Nusrat Hossain, Lecturer, Bangladesh University of Health Science. And the second speaker, Sadia Noor, PhD Fellow, Bangladesh University of Professionals. May I request these two speakers? In addition, we have also one speaker who will joining virtually, Tanmoy Sarkar, BRAC, James P. Grant School of Public Health. So now, I am requesting our first presenter, Nusrat Hossain, Lecturer, Bangladesh University of Health Science.
Thank you very much for arranging first National NCDs Bangladesh. I would like to thanks everyone for accepting my abstract as oral presentation, and my title is Assessment of Lifestyle Practices and Chronic Diseases Among Healthcare Professionals at Selected Hospitals in Gazipur and Dhaka, Bangladesh. We know healthy lifestyle and its relationship to health status has become increasingly clear over the years, and lifestyle factors are associated with the NCDs, which includes cardiovascular disease, diabetes mellitus, stroke, etc. And globally, these chronic diseases are the leading cause of death and disability. A large portion of these diseases are preventable through maintaining healthy lifestyle. Lifestyle refers to people's behavioral patterns. Lifestyle, so what is lifestyle? Lifestyle refers to people's behavioral patterns consisting of taking healthy diet, being physically active, never smoking, and body mass index less than 25 kg per meter square. Why we did this study? Actually, lifestyle habits of healthcare professionals, means doctor, nurses, are of paramount importance, both because of they influence the healthcare professionals' own health, and because these habits have been shown to affect patients' care. So here is a question: do healthcare professionals lead a healthy lifestyle? That's why we choose this study. And it is very important to conduct this study, as there is a very few studies about healthy lifestyle among healthcare professionals. And here is the specific objectives to find out socio-demographic characteristics of healthcare professionals, to assess the presence of lifestyle-related chronic medical problems, and to identify healthy food habits, to find out the level of physical activity, to assess the smoking status also. And this is the methodology. It was a cross-sectional study, and after sample size calculation, we estimated 354 sample, and after adjusting non-response rate, which is 10%, the sample size is 389. And our place of study, as mentioned before, was in Gazipur and Dhaka city, selected hospital. Data collection tool were structured survey questionnaire, and we include Bangladeshi adult aged 18 years or above healthcare professionals, and we include both male and female. We exclude below 18 years or old and who are not healthcare professionals. This is the conceptual framework. We can see here independent variables and dependent variables. We want to identify whether dependent variables is dependent on this independent variable, such as age, sex, marital status, educational status, occupation, religion, or not. And this is the overall result. Our maximum participants was nurse, approximately 66%, and among all the participants, only 13% having chronic medical problems, and most of the participants, approximately 55%, scored better in dietary score, but who scored low need to consider changing to a healthier habit. And there are type of professions like doctor, nurse, allied health, and dietitian, and we found a significant relationship among them. And doctors have higher dietary score than all other healthcare professionals. And this is the comparison among smoking habits. We can see here that male respondents rate are higher than female, and we can also see here allied healthcare professionals, approximately 16% higher than among all other healthcare professionals, and who has chronic medical problems had higher smoking habits than who without chronic medical problems. And this is overall result, and we can we discussed earlier dietary score and smoking status in the previous table, and in this table we can see PA level. What does it mean? Physical activity level among them. We also mentioned that male respondents or male healthcare professionals are highly active than female respondents, and we found a significant relationship between them. And we can also see here that allied healthcare professionals are more physically active than all other healthcare professionals, like doctors, dietitians, and we found a significant relationship between them. This is the conclusion. Conclusion is very important here because this study showed that healthcare professionals are not practicing healthy lifestyle habits properly, apart from the lowest smoking prevalence in female. This indicates working within preventive services as practiced in healthcare and being acknowledgeable of a healthy lifestyle does not ensure practicing it. So our recommendation is healthcare professionals in Bangladesh need to be targeted by health promotion programs. The barriers of practicing a healthy lifestyle need to be explored, and motivation of the people and modification to the work environment to support practicing a healthy lifestyle are highly recommended. And last of all, our recommendation is future studies with a large sample size and more hospitals or healthcare centers throughout the entire country should be considered immediately. Thank you, everyone.
Thank you, Nusrat Hossain. I think it's very clear and precise presentation, and also very eye-opening research I found. So now I would like to request Sadia Noor, PhD Fellow, BUP. So she will be presenting on digital health risk of primary school students. And dear audience, if you have any kind of question about the session, please note it so that we can have a good discussion in open discussion session. Thank you.
Bismillahirrahmanirrahim. Respected dignitaries and jury board members and present audience, Assalamu alaikum. I, Dr. Sadia Noor, am overwhelmed to be a part of First National NCDs Conference 2022. It's a great privilege for me to have my supervisor, Dr. Faria Hassin, as co-author. Now I'm going to present my seminar. The title is Digital Health Risks of Primary School Students, Dhaka City Perspectives. Electronic devices are the iconic invention of modern era. Our life has become easier with the use of various electronic gadgets like the computer, mobile, tablets, along with internet. We used to occupy our kids with these gadgets while doing our daily chores. Children can spend hours entertaining themselves in front of the gadgets, while many studies reveal that the harmful effects of these gadgets are not less though. Rather, it has become the main challenge to control the kids and educate them. Overuse of technology can affect child's physical health. Staring on the screen for a long time can cause eye strain, itching, headache, difficulty in vision. Moreover, it causes postural, muscular, or skeletal disorders like tendinitis, nerve compression, carpal tunnel syndrome. Scientists detected that too much use of screen media released dopamine, which produce addiction similar to drug cravings. This phenomena indicates that children are addicted to gadgets, are more aggressive and less able to control their emotions when the gadgets are taken away. It also results in sleep deprivation. They feel drowsy, fail to concentrate on the class and day activities, and ultimately it hampers the academic performances of the students.
Excuse me, slide is not changing.
I'll change.
I think the same problem. It should be made full screen and then move.
Yes.
The study identified the physical and behavioral problems of the students due to using modern electronic devices. Technology is not a perpetrator. If we use it sensibly and discreetly, we could resolve the harm and have a better outcome in the education system. General objective is to study the effect of electronic gadgets on the primary school-going children. Specific objectives is to study the technological interaction of primary school-going children, to identify the physical problems emanated from gadget usage, to find out the behavioral problems due to gadget usage. Methodology. After getting the proper ethical clearance, this cross-sectional study was carried out among the students of Class 4 from 4 different schools of both North and South Dhaka City Corporations. The students of Class 4 were selected as the students of Class 5 are under busy schedule for PSC examination. And by the age of 10 years, both receptive and expressive languages are well developed, which help for communication, reading, and writing. Simple random sampling method was used to collect data. The sample size was 340, which is calculated by using the formula for cross-sectional study. Selected students were interviewed face-to-face to fill up the questionnaire. The physical tests were carried out by measuring height, weight, and reviewing the vision tests collected from the parents. The results are prepared under the headline of technological interaction of the students. The usage of the devices are categorized into higher usage of gadgets and lower usage of gadgets. Higher usage are those students who use gadgets for 3 to 4 hours, and lower usage are those who use them for 1 to 2 hours. About 87.7% students are higher usage of television, 94.9% students are higher usage of mobile, and 99% students are higher usage of tablets. Maximum students watch cartoons, music videos, and play video games. Both the percentages of higher usage and lower usage are high. Table 2 shows association between higher usage of gadgets with different health indicators. About 11.5% students are myopic, 15% students complained watering of eyes. There is a positive association between higher usage of mobile with watering and redness of eyes. About 31.2% students suffered from headache. Among musculoskeletal problems, 8.8 students have backache. About 9.4% students complained indigestion and gas problems. It's an alarming issue. These are the kids of only 10 to 11 years old. The health of the children are at risk of growing age. This slide shows association between higher usage of gadgets with different behavioral pattern of the children. When the gadgets are taken away, the students got angry and sad. There is a positive association between higher usage of tablets and children's reaction after taking away the gadgets. And I'm certain that this pandemic would have certainly raised these mental disturbances of the kids. There is also a positive association between gadget usage and sleep. Higher usage of mobile and tablet students feel more sleepy in the class. Going through the eating habits of the students, most students used to eat on the table, but those who watch gadgets, most of the higher usage of television, mobile, and tablets watch television. Although students love to play both indoor and outdoor games, the number of students who love to play online games are more. Conclusion: to make the gadget usage fruitful is a prime need at this point so that we could have protected our children from the threat of electronic gadget use. Public health implications: a holistic approach could prevent the harmful physical and mental effects of overuse of gadgets. Recommendations: education of our country is all about academic and theoreticals. Art, crafts, sport, music are theoreticals. Information and communication technology classes should be more practical. Guidelines should be given from school to search online links to do homework and project works. This could distract the children to use gadgets mere as a recreational tool. Children are getting very much addicted to online violent games. So BTCL could have controlled the game download options so that parental monitoring would have ensured. Lastly, parents should be motivated and psychotherapy should be given to both students and parents to control the gadget use. At the end, I acknowledge my esteemed supervisor, Dr. Fariha Hassin, Associate Professor of Department of Public Health and Informatics, Bangabandhu Sheikh Mujib Medical University for her excellent supervision, and Bangladesh University of Professionals for letting me doing my PhD, and finally for the PhD scholarships from the Prime Minister's Education Assistance Trust. Thank you all.
Thank you, Sadia Noor, for your nice presentation. I am sure you have taken your notes to discuss a very good session because I think today we have sufficient time to discuss more because our today's so far two speakers, they are very kind to time and we have some time. Thank you very much. So now I would like to request our third and last speaker who will joining virtually, Tanmoy Sarkar from BRAC James P. Grant School of Public Health.
Okay, first of all, good afternoon, everyone. First of all, I, on behalf of my institution, Center for Non-Communicable Disease and Nutrition, pay gratitude to organizers for giving me the opportunity. Today, I am presenting service availability and readiness of health facilities for non-communicable diseases in 2 sub-districts of Bangladesh. As you know, Bangladesh is now experiencing an epidemiological transition with increased burden of non-communicable diseases. Non-communicable diseases are now responsible for 67% of yearly mortality and 64% of disease burden. We know that maximum people of our country take their service from primary healthcare facilities. So it's important, I think, to assess the service availability and readiness of health facilities for non-communicable diseases in Parvatipur and Birampur sub-districts. That is our objective. Actually, we selected two sites from under the Dinajpur district. One is Parvatipur sub-district and another is Birampur sub-district. Parvatipur is larger by area and population than Birampur. You can see that. We visited actually 100 facilities. So we found 100 facilities there, 64 from Parvatipur and 36 from Birampur. Those are the list of health facilities present situated in these two sub-districts. The highest number is community clinic, which is 61, and the lowest is sub-district hospital, which is 2 in number. So we conducted this cross-sectional study between July to September 2020 using World Health Organization recommended service availability and readiness assessment tool modified for recording NCD related infrastructures, resources and services. So what is the outcome? What is the result? We found 58.5% of physicians were available against their total position, whereas the number of nurses and midwives are more than them, which is 80.2%. Only 32% of health facilities had at least 4 out of 6 basic amenities. We all know about the basic amenities: emergency transport, internet, communication, sanitation, water, and power. Overall, 77% of health facilities had 4 tracer items. Tracer items like stethoscope, thermometer, blood pressure apparatuses, and adult scale. Availability of counseling services for NCD risk factors and self-care was highest for diabetes, which is 95.3% of facilities, and lower for cancer, which is 34% of facilities. No health facilities were using WHO recommended 5A, 5R approach for counseling. 48% of health facilities had arrangement for they can do a random blood sugar test. All facilities could measure blood pressure. They have that blood pressure measuring apparatus. 24% of facilities in Parvatipur and Birampur adhered to national guideline for management of hypertension and type 2 diabetes mellitus. Electrocardiograph was available in only 9.5% facilities in Parvatipur only, not in Birampur. Overall, only 10% of facilities of both sub-districts performed screening and referral for cancer, mental health disorders. 17.5% of facilities in Parvatipur and 14.3% of facilities in Birampur had their own oxygen supply capacity. 41.0% of facilities had no communication materials available. And only one facility of Birampur had pyrometry facility. Retinal imaging or fundoscopy and mammography were absent in any health facilities. Tablet salbutamol, which is a bronchodilator, was available in 71% of facilities. Aspirin, statin were available 6 and 11% of facilities respectively, whereas the oral hypoglycemic agent metformin is present 13% of facilities So we can say that Parvati and Birampur suffered from a shortage of human resources, equipment and supplies, and NCD-related preventive and control services. So we have to focus, it is essential to focus to ensure trained staff, appropriate guidelines, required instruments, and medicines there. Finally, we want to thank the participants, data collectors and data collection supervisors, local health authorities and local administration. We admit our special thanks to the National Institute for Health Research, UK, for funding this activity. And thank you all the best wishes for the first National NCD Conference.
Thank you, Tanmay Sarkar, for your nice presentation. So we would like to now invite our today's session chair, Dr. Jeba Mahmood, to conduct the open discussion session.
Madam Chair and speakers, very nice and important presentations made by all three of you. So I'd like to take privilege of asking a few questions to each of you, but take your time for answering the question. Is that okay, Madam Chair? May I ask the question? I have some clarity for question for three of them, or I should go one by one. So I have questions for all three presenters. So I'm just asking whether I should ask one by one or ask all of them the same time and they can present.
State your questions.
Okay. So my first question would be to Sadia Noor. Sadia Noor, you actually did a very nice study with a very large sample, if I'm not wrong, from 10,000 plus children. I was just not very clear to me. But my only question about that is how did you select these children? Are they randomly selected, and is the result that you are interpreting, are they generalizable for other children from the kind of schools that Bangla medium, English medium, and government schools have picked up? Will that be generalizable for others? So that is your question for you. My second question was for, I think this is Nusrat, the first presenter. So you actually did a very important study, extremely important study, and trying to see the health professionals are not aware about their healthy lifestyle need. But I think I have a similar question to you. So I see only the Ghazipur and Dhaka. And there are many hospitals in those two cities. So my first question would be, why did you choose these two cities? And second would be that how did you select the hospitals? And then how did you select the health professionals within the hospitals? Because we see there are 67% are females and mostly nurses. So this was a bit unclear. So this probably have put some bias in your study because they're mostly women, and we see that smoking is 5%. That means women don't smoke, but what about tobacco consumption? We don't know. So do you have any question, data on that? That would be wonderful to know. And the last one is Tanmoy. Tanmoy did a very, very important study, and I think he captured a very large number of health facilities. And we see interesting results, such as there is no fundus photography, ECG, very low. But I am just struggling to understand that there are a good number of community clinics where we are not supposed to get any NCD drugs as per policy, and there is no ECG or fundus photograph facilities are expected to be available, whereas compared to tertiary care hospitals, we are supposed to get all kind of facilities. But you combinedly presented it, and that's how it is showing very different pictures. So is it possible to let us know that wherever the NCD facilities should have NCD equipments and drug supplies, did you find them available there as opposed to comparing community clinic and tertiary care hospitals? Thank you.
Actually, I want to make some comments about these three young scientists. Very good presentation, and they have taken the practical aspect of our daily life. I want to congratulate all three of them. Thank you very much.
Thank you, ma'am, for your questions. I have the study population was approximately 10,000, which were the primary students of Dhaka board. I collected that data from Mirpur National Dhaka Board of Primary Students. And the schools were selected randomly from North and South Dhaka City Corporation. And I selected the samples by simple random sampling method. Thank you, ma'am.
Thank you. My two questions were, how did I select those hospitals? As the first author was my MPH student, Belayat Hossain. His convenient location was Gazipur and Dhaka district. And the second question was, who are present, why more female in my study? I think those are present at the time of data collection. That's why we found more female than male respondents.
Thank you very much. Now over to Tanmay Sarkar. Are you still there? Can you respond?
Yes, I'm here. Okay, thank you for the question. Actually, we know that all the people, maximum our community people, take their services from their primary healthcare services from the primary healthcare facilities like community clinic and those facilities. And we know that government will give the medicines and healthcare ECG machine or those things to the community clinic level hospitals. So we included them because a huge amount of people take their services from there. Just let them go. That's why.
Thank you, madam. So if you don't have any question, so before concluding, we would like to listen from our very enriched panelists today. First, I would like to ask Dr. Abu Jamil Faisal sir, Chairman and Treasurer, Health 21. Sir has more than 35 years experience in public health. So I would like to request sir to share his insight and experience about this session.
আসসালামু আলাইকুম এবং সবাইকে শুভেচ্ছা। আজকের এই কনফারেন্সের প্রথম তো হলো যে অবজারভেশন যে ইটস সাচ এ চ্যালেঞ্জিং টাইম এবং এরকম একটা চ্যালেঞ্জিং সময়ে এই ধরনের একটা কনফারেন্স করা যেখানে কি অর্ধেকের মতন প্রায় অনলাইনে কানেক্টেড এবং একটা প্রেজেন্টেশনও অনলাইনে হইল। So facing all of these challenges, having still some people in the audience, it's a great thing. I would like to congratulate the organizers first, যে এইরকম একটা সময়ে এই ধরনের একটা উদ্যোগ নেওয়া এবং তার উপরে the topic is so important. The topic, when more than 60% of the deaths are occurring due to NCDs, so how much importance it bears, the topic itself bears. So having a discussion on the three presenters, all the three presenters, they presented a lot of data. And I think that from this conference, the recommendations, the suggestions which will be sent to the Ministry of Health and Family Welfare and the Director General of Health Services, there should be someone there to look into the recommendation, because all of the recommendations would be so important and so that we need to take steps. We need to take immediate steps. আমাদের আজকে এনসিডি সম্পর্কে আমরা সবাই জানি যে কীরকম মারাত্মক অবস্থা ধারণ করতেছে। যদি 60% ডেথ যদি ওই এনসিডিগুলোর থেকেই হয়, তাহলেও আমি জানি না যে কেন আমাদের এখনও চৈতন্য উদয় হচ্ছে না যে আমরা কিছু একটা ইমিডিয়েটলি কিছু একটা করি। আমাদের পড়াশোনার মধ্যে অনেক কিছুই পড়ানো হয়েছে, কিন্তু সেই পড়াশোনার যে বাস্তবায়নটা, যে ডক্টর তন্ময় যে বলল যে আমাদের কী অবস্থা, হসপিটালগুলোতে ফ্যাসিলিটিস নাই, তো সেইখানে আমাদের তাহলে কি আমরা করছি? আমরা আবার এসডিজি গোলসকে রিচ করার চেষ্টা করতেছি। এইখানে আমাদের এখনও যে স্বাস্থ্যের যে definition, all of us, we take that definition, যে the lack of the diseases is the health. স্বাস্থ্য বলতেই আমরা মনে করি যে অসুস্থতা নাই, সেটাই আমাদের স্বাস্থ্য। কিন্তু ওইখানে যে আরও যে 3-4টা জিনিস WHO বলছে, সেই 3-4টা জিনিসের যদি দিকে নজর দেই, আমাদের মেন্টাল, ফিজিক্যাল, স্পিরিচুয়াল ওয়েলবিং, we probably will be able to tackle the NCDs. NCD যখন নাকি কোনো একটা এই নন কমিউনিকেবল ডিজিজের আমরা বুঝতে পারি যে হইছে, ডায়াবেটিস হইছে, না ক্যান্সার হইল, না কি আমাদের হার্ট ডিজিজ হইল, এটা তো অনেক দিন আমাদের জীবনের শেষের দিকে গিয়ে, অবশ্য এখন সেই যুবকদেরও হচ্ছে, তারপরে বাচ্চাদের হচ্ছে কীরকম, সেই স্থূলকায় হয়ে যাচ্ছে বাচ্চাদের, সেই মেদ জমতেছে। কি জন্য? যে তাদের কোনো রকম আমরা ওই জাতীয় খাবার খুব কম দেই, যেগুলো না খেলে পরে আর এই মেদ জমতো না, এবং পরবর্তীতে তার এনসিডির সেগুলো হইতো না। দ্যাট মিনস উই হ্যাভ টু বি মোর কেয়ারফুল in providing promotive health services, in providing preventive health services. আমাদের কমিউনিকেশনগুলো হইতে হবে যে তোমরা এইটা করো, এক্সারসাইজ করো, ফ্রি হ্যান্ড এক্সারসাইজ করো। আমাদের একজন আজকে প্রেজেন্টারের মধ্যে ছিল যে ইফেক্ট অফ এই কম্পিউটারের সামনে বসে থেকে, টিভির সামনে বসে থেকে বাচ্চাদের কি অবস্থা হচ্ছে। তো সেইখানে বাচ্চাদেরকে তো ওই টিভির সামনে এখন থাকতেই হবে, কম্পিউটারের মনিটরের সামনে থাকতেই হবে, কারণ আবার অনলাইনে ক্লাস শুরু হয়ে গেছে, এবং অনলাইনে ক্লাসগুলো তো করতেই হবে। আমার বাসায় আমার নাতি যে 12 বছর বয়স, ক্লাস 7-এ পড়ে, গতকালকের থেকে দেখলাম অনলাইনে ক্লাস শুরু হয়েছে, এবং ক্লাসেরও টাইমিং এত উইয়ার্ড টাইমিং, 6টা থেকে রাত 9টা। তো ওইখানে ওকে আমি বলছি যে তোমাকে তো এখন সারা দিনই প্রায় এই কম্পিউটারের স্ক্রিনের সামনে থাকতে হবে, তো why don't you buy a spectacle with a zero power glass, ইয়েগুলা, যেগুলো নাকি শুধু ওই ব্লু রেটাকে প্রোটেক্ট করবে, এবং সত্যি সত্যি ব্লু রে প্রোটেকশনের জন্য গ্লাস পাওয়া যায়। I had no idea, but that I learned. So আমাদেরকে ওই জিনিসগুলো, প্রিভেন্টিভ যত জিনিস আছে সেগুলোই বোধহয় করতে হবে। ইভেন আজকে যখন নাকি আমরা এই করোনার তাণ্ডবের মধ্যে দিয়ে যাচ্ছি, ওমিক্রন হু হু করে ওমিক্রনের বাড়ছে, ইনফেকশন বাড়ছে, ট্রান্সমিশন বাড়ছে। এই কোভিডের কিন্তু পোস্ট কোভিড অনেক ধরনের সমস্যা হচ্ছে, এবং সেগুলোও কিন্তু এই এনসিডির মধ্যেই পড়বে। মায়োকার্ডাইটিস হচ্ছে। মানে মায়োকার্ডাইটিসের মানে অনেক কোভিডের পেশেন্টরা, কোভিড আক্রান্ত লোকেরা এই হার্টের সমস্যার কথা বলছে, যেটা নাকি আগে তার ছিল না। সো দ্যাট ইজ এ নিউ এরিয়া হোয়ার উই নিড টু পে অ্যাটেনশন। আমরা শুধু আজকে মাস্ক পরে হয়তো বা আমার সংক্রমণটাকে ঠেকাতে পারবো, কিন্তু কোনোভাবে সংক্রমিত হলে পরে ওই জিনিসগুলোর দিকে তো আবার লক্ষ্য দিতে হবে, যে আজকের থেকে 6 মাস পরে, 7 মাস, 7 মাস, 8 মাস পরে কি হবে। তো আমাদের ওই ওভারঅল আমি মনে করি যে আমাদের পাবলিক হেলথের যেসব প্রিন্সিপলস আছে, public health has no conflict with the clinical health. But if we want to stay healthy, if we want to follow the principles of WHO, the definition of health, we probably will have to give a little bit more weightage to the preventive, promotive, and social medicine. আমরা যদি তা না করি তাহলে আমাদের সামনে কিন্তু আরও অনেক দুর্গতি আছে। এই করোনার থেকেও আমাদের যে খুব তাড়াতাড়ি আমরা পরিত্রাণ পাবো সেটাও হবে না। উইল হ্যাভ টু লিভ উইথ করোনা, অ্যান্ড অ্যাজ সাচ হাউ উই লিভ উইথ ইট উইদাউট বিং ইনফেক্টেড। মানে আমরা বাঁচতে হবে ইনফেকশন যাতে না হয় সেটার দিকে লক্ষ্য রেখে, এবং তারপরে হলো ক্লিনিক্যাল যত কিছু আছে সেগুলোর প্রতি। I would like to stop here by saying that it's a great event. The organizers need to be thanked a lot, and they have worked very hard, particularly combining these two things. এখানে ফিজিক্যাল কিছু আছে, ওইদিকে পিছনে অনলাইনে আছে। It's a great combination, it's a hybrid combination of doing a conference. So I wish them best of luck. তাদের তো আরও 2 দিন বাকি আছে। So I hope that this would give us a lot of good recommendation on which all of us, including the government, should have to start working. Thank you very much.
Thank you, sir, for your very practical words. So as you have a time, just I would like to share my one word. So I have got lot of experience, lot of advice in my life. But being a student of public health, I realize that the best advice what I ever get, that is prevention is better than cure. So I would like to request everyone, I think this is not a advice, this is a very practical message from public health, and amidst the COVID-19, I think it has been the most relevant message to all of us. So at this point, before listening our session chair, may I request to all of you to have a claps for the organizers. A big claps, yeah. Thank you, and especially I would like to thank 2 people. I can see the Shamim Bhai, who was so much instrumental throughout the process, and also the Alia ma'am. So I think these 2 persons have done tremendously good for arranging this this program. And of course, there are a lot of organizers. I cannot mention the name, but I'm sure it's a combined effort, but I'm sure these 2 people have done a lot. So thank you very much, ma'am and sir. Now I would like to request Dr. Jeba Mahmood, Senior Advisor, Strategic Partnership and Knowledge Learning, Alive and Thrive, for her concluding speech.
Assalamu alaikum, good afternoon, শুভ অপরাহ্ন। Yes, প্রথমে অবশ্যই আমাদের ধন্যবাদ দিতে হবে বাংলাদেশ Non-Communicable Disease Forum, who actually invited us, and Eminence. You all know individual names, so I will not go through them, but a big thanks to all of them for organizing this conference when it is very much needed. As we all know that all around the world now we are going through a big pandemic which is ending and then again restarting, so it's a We really don't know what's going to happen at the end. However, there is a very significant epidemiological transition here. And we have seen that there is a steady rise in the trend of non-communicable disease. There are around 50 non-communicable diseases globally, out of which we are very familiar with ones, that is cardiovascular disease, diabetes, chronic respiratory disease, cancer, and mental health disorders. Time and again it has been said that 67% of our populations actually die due to these NCDs. However, I would like to mention that most of our 160 million population is actually suffering from one sort or the other NCD, which we are not aware of. And this is mainly due to our behavioral and certain chronic health risks. Our behavior things has been actually being talked about. It's our dietary habits, it's our way of life, the physical inactivity, and use of tobacco, and added to is the problems of hypertension, that is high blood pressure and high glucose concentration in the blood. And it has come out in the 3 presentations as well. Like number 1, the service providers. Health service providers are not aware themselves. Less than 50% are actually not at all aware of what is non-communicable disease, nor are they aware that whether they are suffering or whether they're living a healthy lifestyle. And the other presentation that showed that even little children are going to very soon become obese. I use the word obese, which is actually the last end of the malnutrition, because of watching too much TV, sitting in front of the TV, and physical inactivity. And added to it, I would say that it's not only the teachers who should be conscious, it's the parents. Number 1 comes the parents, who should be conscious about what's happening to their children and what it can lead to, what is the end result of this physical inactivity and bad dietary habits. We know that Bangladesh is now in a double transition. Amader bhalo kichu hocche, we have a higher life expectancy, which is very good. Our immunization rate is very high. Our literacy rate is going up day by day. We also have declining fertility rate. However, we can also see the other end, which is shifting towards a disease burden, especially due to this non-communicable disease. And one thing I would like to mention, by the way, is that our health system is too much curative, treatment-oriented. It's time that we support a health system which is more preventive-oriented than curative, especially for NCD. If we could be successful for our immunization prevalence rate, immunization rate, we can also be successful for preventing NCDs. And for that, of course, we will need strategic planning, coordination among the various sectors, private and public partnerships, and have a certain goal and good operation plans, and a very robust health information system. I end by hoping that at the end of this conference, we come up with a very good recommendations and suggestions which will not only talk of the curative side, but also of the preventive side of health. Thank you very much.
Thank you, madam. I think it ends. So thank you very much for listening us. And thank you all of the presenters, the session chairs. Thank you very much.